Hi, my name is Cameron Kowalski, and I'm a Master's of Public Health candidate working with the Campus Health Center to provide this webinar on understanding sexual health in college. It is very common for sexually active people to have had a sexually transmitted disease and not even know it. Studies show that by the age of 25, 1 in 2 sexually active people will have had an STI and not know. In the United States, people aged 15 to 24 account for half of the 20 million new STIs each year. If you are having sex, take your health into your own hands. Learn more about what sexual health is, how to protect yourself from STDs and STIs, how to prevent unplanned pregnancy, and what safe sex is and how to have safer sex while in college through this webinar. What is sexual health? According to the World Health Organization, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It requires positive and respectful approach to sexuality and sexual relationships free of coercion, discrimination, and violence. According to the CDC, sexual health is not just about avoiding diseases, but cultivating a positive connection to sex and healthy sexual relationships. Let's talk about the most prevalent STDs on college campuses. This slide has common STDs and the percentages of how many students are affected. Herpes, HSV1 is 60%, EBV at 56%, HPV is less than 43%, chlamydia 3%, gonorrhea 2.1%, trichomoniasis is 2.3%, herpes SHV2 at 1.6%, HIV at 0.5%, and syphilis at 0.03%. So how do you recognize the signs of infection for these common STDs? Signs of chlamydia include painful urination and genital discharge. Signs of gonorrhea include genital discharge and a persistent sore throat. Signs of trichomoniasis include genital itching, burning, or redness. Signs of HPV include genital warts and cervical lesions. Signs of herpes include genital, oral, or anal sores. Signs of syphilis include rash, hair loss, and muscle aches. Signs of HIV include fever and swollen lymph nodes. Keep in mind that every person may experience signs differently, in which you may not experience any of the symptoms or at all. This is why it is important to regularly get tested for STDs if you're sexually active, as you may have an STD and not even know it. Here are some ways you can protect yourself from STDs. Using different forms of protection, such as condoms, dental dams, or latex underwear. Dental dams are latex or sheets that are used between the mouth and genitalia during oral sex. Ready-to-use dental dams can be purchased online. Latex underwear has been FDA approved to use for preventing STIs during oral sex. The underwear is said to be dental dams reinvented, in which it provides a protective layer that covers the genitalia. Discuss practicing mutual monogamy with your partner. There are also vaccines for different STDs, such as the HPV vaccine, which we will discuss more in depth. And you can practice abstinence and get regularly tested for STDs if you're sexually active. It is very important. Let's talk about the HPV vaccine. HPV is the most common STD. There are more than 200 types of HPV, in which 40 kinds can infect your genital area. A dozen types of HPV can lead to cancer, in which the most common type of cancer developed due to HPV is cervical cancer. You can get your HPV vaccine at the Campus Health Center. You may have already started your HPV vaccine series, as it can be given starting at age 9, but teens and young adults such as yourselves to the age 26 who have not started or finished the series can still start it. Only 2 doses are needed if the first dose was given before your 15th birthday, but 3 doses are recommended for those who start the series later in life or have a weakened immune system. Other than STDs, pregnancy is a major part of sexual health. Unplanned pregnancy in college can completely change your life plan if you're not careful and using protection. Here are some tips to prevent unplanned pregnancy in college. Follow safe sex practices, such as discussing past partners, your history of STIs, and drug use, and use condoms every time you have sex. Use 2 contraception methods. There are barrier methods such as condoms, diaphragms, and spermicide. Birth control methods such as IUDs, implant, injection, or shot, oral contraception, which is the pill. There's also a patch or a ring. Use emergency contraception as needed, including copper IUDs and the emergency contraception pill, such as Plan B. For Plan B, keep in mind that you should take it as soon as possible and less than 72 hours after unprotected sex. There is another brand called Ella that you can take instead, which you should still take as soon as possible and less than 120 hours after unprotected sex. Plan B is available over the counter without a prescription in the state of Michigan. Ella, however, is not available over the counter, so you should reach out to your doctor if you are interested in it. You can find Plan B off the shelf at pharmacies and grocery stores, and there's no age restriction for purchasing it. Keep in mind, if you take an emergency contraception pill such as Plan B, Take Action, My Way, or any other brand that has Levon or Registrol, it is not as effective if you weigh more than 165 pounds. However, Ella may work better for you, but if you may weigh more than 195 pounds, it may not work as well. It is important to note that contraception methods are not 100% effective and still may result in unwanted pregnancy, but by using 2 forms when having sex, such as the pill and condoms, you will reduce the risk of pregnancy even more. Lastly, you can prevent unplanned pregnancy by practicing abstinence. For most people, abstinence means not having sex with anyone. Other people may use abstinence to prevent pregnancy on days they're fertile, but they may have sex at other times. This is called fertility awareness. When it comes to preventing pregnancy, doing any or all sexual stuff besides vaginal sex is called outer course. Some outer course examples include kissing, massage, hand stuff. There are a lot of creative ways to get sexual pleasure from outer course, but keep in mind that some kinds of outer course can spread STDs if there's skin-to-skin genital contact or if your partner's sexual fluids get on or in your genitals or mouth. We discussed some ways to follow safe sex practices, but what is safe sex? Safe sex is having any form of sex while protecting yourself and your partner from STDs and unplanned pregnancy. As discussed, this includes using contraception and protection, getting regular STD testing, and obtaining consent. Consent is very important for every sexual encounter you have. Consent must be obtained prior to performing any sexual encounter by all parties involved. It is an agreement between partners to engage in sexual activity. If it is not obtained, this can be considered sexual assault or rape. If you are drunk or high while engaging in sexual intercourse, you cannot legally give consent. And keep in mind that even if you gave consent at the start of the encounter, remember that you can withdraw it at any time if you become uncomfortable. Consent is also not limited to quote-unquote gender roles, as it is likely for males to get sexually assaulted as well. Now that we know what safe sex is, let's discuss high-risk sexual behaviors. These high-risk behaviors include not using contraception or protection, not communicating STD status with sexual partners, and heavy drinking and drug taking, as doing any of these before sex can increase your risk of contracting STDs and unplanned pregnancy. Listed here are some tips to have safer sex. Communicate openly with your partner. Use condoms or other barriers discussed when engaging in sexual activity. Get tested regularly for STDs. Avoid alcohol consumption and drug use. Know how to recognize the signs of infection and obtain consent. The last major topic I want to cover in this webinar is sexual violence on college campuses. 13% of all students experience rape or sexual assault through physical force, violence, or incapacitation. This is among all graduate and undergraduate students. If you are the victim of sexual assault, contact the Wayne State University Police Department immediately at 313-577-2222. You can also seek treatment and/or counseling from your doctor, the CAPS, or the campus health center. If you are unsure or scared about the possibility of contracting HIV due to sexual assault or unprotected sex, you should think about PEP. PEP is post-exposure prophylaxis. This means taking medicine to prevent HIV after a possible exposure. PEP should be used only in emergency situations and must be started within 72 hours after a recent possible exposure to HIV. If you are seeking PEP due to sexual assault, you may qualify for partial or total reimbursement for medicines and clinical care costs. Key takeaways from this webinar are that there are many definitions for sexual health, including that sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. Protect yourself from sexually transmitted diseases by using protection such as condoms, dental dams, mutual monogamy, vaccinations, abstinence, STD testing, and recognizing the signs of infection. Safe sex is having any form of sex while protecting yourself and your partner from STDs or unplanned pregnancy by using contraception, getting regular STD testing, and understanding and obtaining consent. Sexual violence is common among college students, in which 13% of undergraduate and graduate students experience rape or sexual assault. If you are a victim, again, contact the campus police department and seek treatment through CAPS, which is the Counseling and Psychological Services here at Wayne State, or the campus health center. Resources for this webinar include the campus health center and CAPS, which you can seek treatment or counseling for any concerns you may have regarding what has been discussed in this webinar. Links to the websites for Planned Parenthood, the Center for Young Women's and Young Men's Health, Sexually Transmitted Infections Guide, Coalition for Positive Sexuality, and a birth control chart are all listed for any questions or concerns you may have regarding your sexual health, STDs, contraception methods, vaccinations, pregnancy, or any other topics related to sexual health. The campus health center also has a social worker on staff that can help with counseling. You can call by the phone number listed here or go online to schedule an appointment at health.wayne.edu. This slide includes all of the contact information for the campus health center. You can also follow us on social media with the usernames listed. The campus health center is also now offering telehealth visits through telephone or webcam. If you're interested, you can call the number listed here or go online to schedule an appointment at health.wayne.edu. These are the references used in this presentation, and thank you for watching.